Hi, my name is Lacey Pittman, and I'm an occupational therapist at Trustpoint Rehabilitation Hospital in Lubbock, Texas. Today we're going to be talking about spinal cord injuries and some of the equipment that we have available to allow these patients to be more independent. But before, let me discuss my role. As an occupational therapist, we work on eating, grooming, dressing, bathing, and toileting. So we'll talk about the difference between a quadriplegic and a paraplegic, and then incomplete and complete. So a paraplegic is when 2 out of the 4 limbs have been affected, meaning if you had an injury at the thoracic level, you would have function of your arms, but not your legs. A quadriplegic is someone who has all 4 extremities affected, meaning if you were affected in the cervical region, you would have limited to no function of your arms and your legs. Now, incomplete versus complete. Complete injury means below the level of injury, let's say again at the thoracic level, you have no sensory or motor function. And incomplete is where you do have motor or sensory function below the level. So if you had an incomplete injury as a quadriplegic at the cervical level, you may be able to move your arms in some way or your legs or still be able to walk. So that's the difference between all of them. Now we're going to focus on some adaptive equipment that we have available. It's mainly for our quadriplegics that have been affected in their arms. So we'll start with this wrist support with a universal cuff. So some people don't have grasp or wrist support, so this will help support their wrist while we stick a utensil in there. They don't have to have grasp, and they can stab their food and bring it to their mouth. Now someone who, we'll use a spoon for this one, who maybe has wrist extension or flexion, they can use a universal cuff and do the same thing, but they don't have grasp. Take this off. This next one is called Dining with Dignity. And so this person doesn't have good function of their hands, but they have some of their wrists, so they can scoop and still bring to their mouth or stab using a fork. This one is a long-handled and flexible utensil. So I'm just bending it and putting it kind of around my wrist like so, and then like so my grasp doesn't have to be very strong. And then I'm gonna do the same thing, stab or scoop and bring to my mouth. So those are just some of the utensils and stuff that we have here. This is a plate guard that would go around the plate to prevent the food from spilling over the edge. And this is a long straw. So somebody who doesn't have the hand function to bring their cup to them, this can be placed away from them. We can always bend this using a heat gun. That way they can always just use their head and try to get a drink with their tray table beside them. And that's all the equipment I have right here. And